Have you ever gotten tired of wearing glasses or contacts? If so, you may have considered corrective surgery. In this episode of OCuTALK, Dr. Barrett Eubanks discusses the similarities and differences between two common types of refractive surgeries, PRK and LASIK. Dr. Eubanks?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us, Dr. Barrett Eubanks. Dr. Eubanks, thank you so much for joining us today.
Thank you, Nick.
Excellent. Well, again, Dr. Eubanks, thank you for taking the time out of your day to visit with us. Dr. Eubanks, before we get started, I was hoping that maybe you can just tell us a little bit about your background and your specialty to our viewers.
Absolutely. So my background is I went through medical school at University of Florida, and it was there that I was drawn into the fascinating world of ophthalmology. I just thought it was kind of really cool and something that I knew I would be very interested in. I went on there to do my residency at Louisiana State University in New Orleans in Louisiana. And I realized that I had a great desire to get people the best vision possible. And that led me to pursue a fellowship specifically in refractive surgery. Those are procedures such as LASIK, PRK, ICL, refractive lens exchange. And I did that at Hunter Vision in Orlando. I worked out there for a few years before joining InVision out here in California, where I currently am. Here at InVision, I'm doing the things that I love to do, doing all the refractive surgery procedures that I really enjoy, and we'll talk a little bit more about today, I assume, such as LASIK and PRK. So it's been a great ride, and I love doing what I do.
Well, excellent. Thank you for that introduction, and thank you again for joining us today, Dr. Eubanks. Like you said earlier, today our topic is going to be talking about the differences between PRK and LASIK. So to get us started, when would someone need these surgeries?
Yeah, so refractive surgery in general, including LASIK and PRK, they are elective procedures. So technically no one ever really needs LASIK or PRK, but these surgeries can be very helpful for people that are just really fed up with glasses and contact lenses. There are certain people who benefit the most from these surgeries. Now, if you enjoy running, you probably have already realized pretty quickly that running with glasses just isn't really a winning combination. The glasses can fog up, it can make it hard to see. People who enjoy swimming, same thing. They often have to go without correction at all while swimming. So both of those, they just get a lot of benefit from refractive procedures. Had stories from patients where they may be hiking out on a backpacking trip, and they ended up losing their contact lenses while hiking, which instantly they just can't have any trouble seeing. They had to have their friends help kind of get them home. People who like to travel, it's very difficult to travel with contact lenses, contact lens solution. People who work in the kitchen, the steam can constantly cause fogging of glasses. We frequently see a lot of new parents, since kids just love to reach up and grab glasses off of faces. And of course, plenty of people who just don't want to have to rely on glasses. You don't want to have to wake up and reach for glasses just in order to see. So there's quite a few people that really will benefit from refractive surgery, which is why these surgeries work very well.
Well, perfect. Thank you for that information, Dr. Eubanks. And so you talked a little bit about who would get these surgeries. What makes a patient good for refractive surgery? Can you go into a little bit of that as well?
So what refractive surgeries such as LASIK and PRK do is they take the vision that you see with your glasses and contact lenses, and they make it where you no longer need those glasses and contact lenses. Because of this, it is important that one already sees well with their glasses or contact lenses. This means that they have healthy eyes, If there is any issues with the eyes, dry eye being a very common one, it's important that we treat the dry eye ahead of time in order to give them the healthiest eyes possible going into any sort of refractive eye surgery. In addition, it is also important that the prescription is stable as well. If the prescription is continuing to change, which this can happen for younger individuals before their prescription is stabilized, then ultimately that can affect the results and reduce the accuracy or the longevity of the treatment. So overall, if your prescription is nice and stable, it's been stable for years, you see well, you have healthy eyes, then that frequently makes you a very good candidate to get your vision corrected with LASIK or PRK.
Well, again, excellent information, Dr. Eubanks. And so now that you've discussed when someone would get these surgeries and who would be a good candidate, I wanted to go into them a little bit more specifically if we could. So what exactly is PRK and what happens during a PRK surgery?
So PRK stands for photorefractive keratectomy, and it's a mouthful, but essentially what it does is we use a specific laser called an excimer laser. That laser energy is applied to the cornea and it causes it to change shape. This is a very precise process. This laser causes microns of change at a time. And so it's been a very tightly adjusted in order to correct vision and kind of do it in a very reproducible process. During the PRK surgery, there's kind of two steps to the surgery, and it's because there's different layers of the cornea. The bulk of the cornea, which is the structural framework part of the cornea, is called the stroma of the cornea. And that's kind of that's the part of the cornea that during a PRK surgery, we apply laser to. But sitting right on top of that stroma layer is a thin layer called the epithelium. And the epithelium serves more as like the skin of the cornea. So in order for the treatment to work well, this laser energy needs to be applied to the stroma. So during PRK, we have to remove that epithelial layer in order to apply that laser energy. Don't worry, that epithelial layer grows back following the procedure. It allows, and it does add a little bit of recovery time after PRK. But by applying that laser energy to that stroma, it allows for a very nice, consistent, reproducible result.
Well, thank you again, Dr. Eubanks, for that information on PRK. So now what about LASIK? What happens during LASIK surgery?
Yeah, so LASIK applies very similar principles to PRK. With LASIK, we actually use the exact same laser to do the prescription treatment. That laser is still applied to the structural framework of the cornea called the stroma as well. The one key difference between LASIK and PRK is how we get down to that stroma. Now, with PRK, as I mentioned, we have to remove that epithelium, the skin-like layer on the surface of the cornea in order to get down to the stroma. With LASIK, what we do instead is we create a small little window called the LASIK flap, in which we fold back in order to directly and immediately access that stroma for the treatment. This LASIK flap is then replaced at the end of the surgery in order to allow for just a quicker recovery time.
Well, perfect. Again, thank you for that information, Dr. Eubanks. And I know with every different surgery, there's always side effects. And so what are the different side effects in regards to PRK and LASIK?
So LASIK and PRK have both gotten to be one of the safest procedures around. However, as with any procedure, there are a few things which are good to know about heading into it. And that is the same with LASIK and PRK. There are a few side effects that everyone will have to some degree. One of the most common side effects that anyone with any laser eye surgery will have is dry eye. Because of this dry eye, that's why we spend so much time getting the dry eye under control prior to the procedure. With this dry eye, it's frequently managed with artificial tears after the surgery. And gradually, as everything heals up, this dry eye continues to improve and return back to pre-procedure levels. A second side effect that everyone will notice to some degree is an increase in nighttime vision symptoms or halos around lights at nighttime. This is a side effect due to the way the procedures do their treatments. When we look out of our eye and through our cornea, we look through the center of our cornea, and that's the part that the lasers used in LASIK and PRK treat in order to provide good vision. But light can enter through the sides of our cornea as well. And because LASIK does not treat the sides of our cornea, that can allow for an extra scattering of light and causing halos around lights at nighttime. Halos around lights has actually dramatically improved through the years with innovations and advancements in the technology behind both LASIK and PRK. In general, what people can expect with halos is more so that they see it, but it's not very bothersome. And then gradually over time, as the brain adjusts to it, that all continues to fade away as well.
Oh, perfect. Again, thank you for that information, Dr. Eubanks. And so now that we've talked about the side effects of both surgeries, I wanted to talk a little bit about the recovery times. How do the recovery times compare between the two? And is the post-operative care the same with both, or how does it differ?
Yeah. So as I mentioned before, there's kind of one key difference between LASIK and PRK. With LASIK, we create a LASIK flap in the cornea in order to get down to that stroma in order to treat. With PRK, we remove the very surface layer of the cornea called epithelium. That one key difference creates a large difference in the recovery time between the two different procedures. That epithelium that's removed during PRK does have to take some time in order to heal over. And this healing time takes approximately 3 to 4 days for that epithelium to fully heal over the cornea. While that epithelium is healing, after PRK, one will notice blurry vision. One will also notice some discomfort on the eye. Both of these two things, they gradually fade away over the course of the first week. And then once you get beyond the first week, the eye continues to heal and recover, and the vision continues to improve with PRK. And so with PRK, we are looking at a lengthier recovery time compared to LASIK. With LASIK, that LASIK flap allows for a recovery time of just about a day. Within the first 2 to 3 hours after LASIK, you still can have some scratchiness to the eye just due to that tiny semicircular scratch where that LASIK flap is. But once you get beyond that first day, much of the vision has already sharpened up, and much of the discomfort has already gone away. And so ultimately, that's just the biggest difference between LASIK and PRK.
Well, perfect. Again, thank you for that information, Dr. Eubanks. And Dr. Eubanks, I know you've said it earlier in our conversation that both surgeries have become very safe over the years. I wanted to ask, though, with every surgery, there's always a risk also, but is there a safer option than the other? Is LASIK safer over PRK? Is that a thing?
So both procedures are very safe. And the two different procedures have slightly different additional risks to the procedure. All the additional risks are extraordinarily rare, but as you can imagine, some of the unique risks with LASIK have to do with that LASIK flap itself. Having a LASIK flap on the surface of your eye puts you at a higher risk that that LASIK flap could be disrupted with any injury to the eye. Fortunately, this is extraordinarily rare. Since the way LASIK flaps are created today with the lasers that we use with LASIK, the LASIK flaps have become very strong and very difficult to disrupt after the LASIK procedure. But PRK doesn't have this risk, and so ultimately it reduces that risk from LASIK. However, there are some unique risks with PRK that LASIK doesn't have as well. One of them is that the treatment itself can create extra inflammation on the surface of the cornea. And this inflammation can lead to the development of a haze on the cornea. In very severe cases, this haze can cause vision to decline and require additional treatments in order to remove. But similar to how we've gotten better over time, improving the stability of LASIK flaps, we've also gotten better over time with our ability to prevent corneal haze from developing as well. And overall, the incidence of that is extremely rare as well. So it's a very similar risk to both LASIK and PRK. If you had to side with one over the other, PRK may have a slightly less risk profile just simply due not having that LASIK flap, but it's very rare that there's any problems with either of the procedure. If we talk about one common risk, I will say to both of them, which the accuracy of these procedures are very high, and it's close to getting everyone 100% on target with their particular prescription, but the accuracy is not 100%. There are a few patients that can have a little bit of prescription remaining, and this is very similar between both procedures, where they may require an enhancement in the future in order to get their vision fully corrected. But ultimately, despite that, the risk of losing vision with either LASIK or PRK is extraordinarily rare.
Well, excellent. Again, thank you for that information, Dr. Eubanks. And one question I wanted to ask also was, is there ever an instance that you've had or that you know of where one surgery would be preferable over the other? Like, I'd rather do LASIK than PRK. Has that ever happened before?
Yeah. And there's particular instances where PRK definitely is a better choice. As I talked about with that LASIK flap has a very small potential to be disrupted if there is any trauma to the eye. There are certain professions where people get repeated trauma to the eye. Boxing is one of them. MMA fighters is another. And ultimately, PRK would be the preferred procedure for those particular individuals, simply just due to the repeated trauma that they get week over week to their face and their eyes. But PRK can also be useful in a few other scenarios. With LASIK, creating that LASIK flap requires a certain amount of thickness to the cornea. When we talk about doing safe treatments with any laser eye surgery, we want to preserve a certain amount of cornea. Each laser treatment can cause some thinning to the cornea, and if we treat the cornea too much, this can weaken the cornea and cause it to change shape over time, which can cause the vision to become blurry. So because LASIK does have that additional thickness requirement of that LASIK flap, for thin corneas, PRK becomes a better choice as well, because it allows us to do a treatment without having to worry about extra thickness due to the LASIK flap. It allows us to, in general, do safer treatments on thinner corneas. Finally, PRK is also very useful when we talk about doing enhancements for patients. And this comes into play for someone who may have had LASIK about 15, 20 years ago. And if they had any regression to their LASIK, they can have some additional prescription and require additional treatment in order to correct their vision. Now, it is possible to do a second LASIK flap on top of the old LASIK flap, or to kind of get down to that old LASIK flap. But in general, the more conservative, safer approach is to do a PRK enhancement on top of that in order to correct their vision. So PRK still has uses that we use pretty frequently in our day-to-day practice.
Well, excellent information, Dr. Eubanks. And I know from hearing from others and, from a little bit of experience myself, I've had LASIK surgery, and I know that from hearing from other people and experiencing myself, it usually takes about 15 minutes. It doesn't take too long. You're in, you're out. They do it pretty quickly. I wanted to actually ask you how to compare it to PRK. Kind of is it a kind of the same time frame procedure as LASIK, or is one usually longer than the other?
Yeah, it's a very similar time frame. Both procedures are very quick. Both procedures take about 15 minutes. Both procedures are painless as well to go through the procedure, very easy to go through the procedure. In fact, PRK can actually be a little bit quicker than LASIK. With PRK, the one differing step is removing that epithelium layer, that skin-like layer. Whereas with LASIK, we create that LASIK flap. It actually is just a little bit slightly quicker to remove that epithelium than to create the LASIK flap. But overall, in the scheme of things, both procedures are very similar to go through, and both quick and painless as well.
Awesome information, Dr. Eubanks. And are there any new technologies or developments on the horizon with these surgeries that we should be on the lookout for?
So refractive surgery is constantly always going through evolution in order to figure out how can we correct vision better, how can we correct vision safer, easier. And within the past 5 to 10 years, there have been new refractive surgeries developed in order to improve the way that we do things. One of them is actually another laser eye surgery. It has the name SMILE. And SMILE differs a little bit from PRK and LASIK, where instead of trying to use a laser to reshape the cornea, a SMILE instead corrects vision by using a laser in order to shape a lens inside your cornea that you remove in order to correct vision. So SMILE, it's something which is new. It's something which the technology behind it is rapidly increasing, and the availability is increasing as well. But there is a different technology as well, which it works a little bit differently from laser eye surgery, but it's showing increased usage and increased success in correcting vision. In this particular technology, it's called the EVO ICL. And instead of using a laser to correct vision on the cornea, this particular technology corrects vision by using a tiny microscopic lens that we actually place inside the eye. And the advantages of this procedure is that it doesn't lead to any significant change to the cornea. And because of that, it's able to correct very high prescriptions as well that just simply we cannot correct with any laser eye surgery. So both of those two developments are something to continue to follow over the course of the next decade as things continue to improve.
Well, we'll definitely be on the lookout for those developments. Thank you, Dr. Eubanks. And before we leave today, was there anything else that you'd like to tell our audience about?
Yeah. So LASIK and PRK both have their differences. LASIK does have that quicker recovery. PRK eliminates the need in order to have a LASIK flap on the cornea. And ultimately, which one you choose, it's going to work well. And so my advice when you get your vision corrected is to choose whatever procedure you feel more comfortable with. Both are going to work very well to correct your vision and get you out of those glasses and contact lenses.
Well, excellent. Thank you, Dr. Eubanks. Everyone, that was Dr. Barrett Eubanks. Dr. Eubanks, thank you again so much for joining us today.
Thank you.